Hello, good evening, everybody. Welcome to Face Health. Hope you're all well. Thank you for joining us this week. My name is Dr. Zarmi Shanawaz. I'm a family physician as well as an integrative health coach and happily the medical director here at Face Health. For those of you who are not familiar with Face Health, we are a holistic children's health and wellness platform. Our vision is to really provide a one-stop shop for parents and caregivers who can come on the platform, receive expert care from a whole array of different types of providers, learn about different health conditions by using our e-literacy courses, and of course, join our communities and, share experiences and stories, as well as, engage in these educational programming like webinars. And we have a whole host of other tools and functionalities on our website. So please visit f2fhealth.com to find out more. Tonight, I'm very excited to introduce our topic for this evening, which is homeopathy and its use in children. Of course, homeopathy can be used across all age ranges, but tonight we're going to be focusing on its use in children. And helping me with that conversation tonight is one of our face-to-face healthcare providers, Dr. Sergey Krissiouk. Welcome, Sergey.
Yes, thank you very much for making this happen. I would like to introduce myself, say a couple of words about myself. I'm a doctor by education and with a interest in homeopathy, alternative medicine, anthroposophic medicine, life coach as well. And homeopathy and anthroposophic medicine is one of my passions in life. And,
wonderful. So let me go ahead and tell you a little bit more about Dr. Krissiouk, because he's being quite humble, I think. So I want to give everyone a little bit more detail about your background, Sergey. Sergey actually obtained his medical education and his Doctor of Medicine degree in Ukraine some time ago. I won't put any dates in there. But he worked for a couple of years as a pediatrician at the Ukrainian Scientific Research Institute for Pediatrics, Obstetrics and Gynecology to diagnose and treat unusual and unknown childhood disorders related to radiation exposure following the tragedy at the Chernobyl nuclear power plant. So that must have been an incredible experience, and you must have seen so much medicine there. But looking to sort of expand his expertise and gain a deeper understanding of health and disease, Dr. Krissiouk continued his advanced studies in naturopathic medicine, homeopathy, and anthropophysical medicine in England. I hope I pronounced that right. Germany, Switzerland, and Ukraine. He's been a practicing homeopathic provider and educator for 25 years. He took his first homeopathy training course in Kiev in Ukraine back in '91 and worked as the assistant to the chair of homeopathy at the Medical Institute of the Ukrainian Association for Integrative Medicine back in '94-'96. He's since then moved to the US, where he passed all the foreign licensing exams and of course completed the course in clinical homeopathy at the Center for Education and Development of Clinical Homeopathy in New York. So we're neighbors. He has been practicing naturopathic medicine and holistic counseling in the states of Rhode Island, Massachusetts, Pennsylvania, and New York. And as he mentioned a little earlier, his special interests are actually in treating viral respiratory ailments in children and adults, mood disorders, behavioral and attention deficit disorders in children, as well as the treatment of infants and toddlers. So welcome again.
Wow. I didn't realize I've done so much in my life. Thanks.
And so much more to go. So with that in mind, I really want to start the conversation off by kind of discussing, why is homeopathy important? Why are we even having this conversation tonight? And I'd like to kickstart that by actually sharing a very interesting statistic that Sergey shared with me, which really, if we kind of use this, people do not trust homeopaths and do not use homeopathy and homeopathics. Let's move across to this, Sergey. Can you share your thoughts on that?
This is a quite recent statistical data from a reliable source called Statista. And this shows you the retail sales of homeopathic medicines in the United States as of 2018 in millions of US dollars. And you can see there's 4 bars, blue bars, and 5 bars. There's a very narrow bar down there. And you see the top bar, the longest, the biggest, is the total homeopathic medicine sold uh, in 2018 in the amount of $437.3 million. And that's what is registered. Probably
Yeah.
many of those purchases have not been even registered. Second place, cold and flu remedies. The third, pain relief, and children's medicine and digestives. Very last. But you see that homeopathy is in fact very popular, as statistically shown here. Yes.
Yeah, that's actually amazing. It's lots and it's a big industry.
It is, indeed, yes. And there are many producers of homeopathic remedies in the United States and all over the world. One of the biggest and most respectful, it's probably and presented in the United States, is Boiron, a French global company that supplies a lot of high quality homeopathic remedies.
Mm.
On the United States is just one good name, and I know them personally because I actually have an account with Boiron, and yeah, and the apart from just homeopathic, they provide educational courses, and what's good thing about them that they are very clinically minded. So everything, all the webinars I've attended and all the information coming out of them is very well grounded in clinical research and scientific feedback.
Yeah, and we're going to talk a little bit more about the evidence for homeopathies. But for those of us who are not familiar with homeopathy, Sergey, can you just go into the definition of what actually is homeopathy? You know, I think there is a feeling out there of homeopathy as just being kind of a bunch of, you know, random medications or natural substances, but there's definitely a science behind it.
Yes, that's true. Well, homeopathy stems from the two Greek words, homois, like, and pathia, suffering. And the main idea is that the suffering resembles the symptoms that the remedy produces. I mean, the substance would produce, but we'll go into more detail about this later. That's the idea. It's like suffering like the suffering that is caused by a substance in a toxic dose. The German physician and chemist Samuel Hahnemann is considered to be the founder, although these ideas go as far back as to Hippocrates, the father of Western medicine, because he also indicated the usefulness of this approach to cure like with a like. Uh, Hahnemann really was a pioneer of this method, and he put a lot of work into this method. It's a method. It cannot be called well. It's a scientific method, I would say, but the idea is that you take a substance of various origin, prepare it in a certain way, and it becomes a remedy. And when done skillfully, this remedy can be very useful and effective.
Got it. So just again, according to this slide, it's really the introduction of these tiny doses of natural substances, right? That would otherwise, you know, in larger doses would actually produce illness. So there are two branches here that we're going to talk about, major branches of medicine, you know, homeopathy versus allopathy. So if you can describe what these two processes are and kind of what the difference, I guess, between them is.
Yes, it's worth talking about. Allopathy, as opposed to homeopathy, well, allopathy is also a Greek term. Everything good that came to us, Western culture, is from Greek culture. So here we are, a lot of Greek. Allos is other in Greek, and pathia is suffering. So that allopathy is a method of treating disease by use of agents that produce effects different from or opposite to those of the disease treated. So it's, as the slide indicates, in homeopathic approach, the process, the aim of the therapeutic approach would be to align the remedy with the underlying pathological or morbid process and drive it out um, by, uh, by way of actual that introduction of the remedy as the process. And I will speak about that a little bit more. And on the right, this allopathic drug, they work to control and fight or counteract those symptoms of the disease process. And so in that approach, um, we may get immediate result right away and relief. But then we kind of, what happens with drive the process and the disease in the body, in the organism. And it may later on come out in a form of chronic condition or might reappear again in a more tougher form, more difficult to treat and deal with than before. So that's two diametrically opposite um, approaches. And I'd like to say something about this, but I would invite your question and maybe your guidance right now, Azarmi, because you are such a good, such a good host. Please continue.
Yeah, so I mean, to me, what you're saying here is that almost homeopathy, we're using diplomacy and working with the processes at hand, and what you're describing allopathic medicine, which is what we tend to use in Western medicine. We are introducing things into the bloodstream or into the system that are actually working in direct opposition to what is going on as a process. So we're fighting as opposed to working within. So why is this of concern? So what are some of the concerns? Again, I'm of the allopathic practitioner base. That's my medical training. But we're all very much aware of some of the limitations and issues when we're talking about allopathic medicine. So could you just expand for us a little bit on some of these points, Sergey?
Yes, of course. Well, I'm also allopathically trained. I went to a regular medical school, so I know pretty much. I passed all the boards in the United States, and I know I'm well versed with the approach. I understand it in and out, and so these are considerations when using allopathic medicine, and we observe them all. We can see that, and so the failure to look at the whole patient and perceive the entire person in front of a patient as a total entity in its totality, emotional, intellectual, physical, and to address the entirety of the person as a patient. And also, there's also such thing like biography, patient biography. That also plays a big role in that, understanding the condition. Then patient dependence on pharmaceuticals. Yes, once they put, especially in chronic conditions, once they put in the medication, they stay on for a long time, and the list of those medications is so long. Some medications cause side effects, and other medications are given to alleviate those side effects, and we end up with a very long list, and even require the certain boxes and certain method to even not to get confused about what to take and when to take it. So complicated. And of course, dry side effects, intolerance, allergies, that's well-known fact. And there's always some kind of a side effect that we've got to deal with and consider that when we work with allopathic medicine. One-sided unbalanced action of medications is also well-known point, because yes, we allopathic medicine will look to control a certain manifestation, symptoms, and this is the target of the action. And so that's one-sided, but then any substance that is introduced to the body never produces a one-sided effect, and in fact affects the entire body. We just see more pronounced effect, which is we're looking for, is one-sided. So emergence of antibiotic resistance organism, yes, medicinal resistance, Staphylococcus aureus, MRSA is is a terrible menace in the hospital, especially infectious disease department or surgical departments, or there are a number of others that is well known, and there's a hospital acquired infections that are so serious and so difficult to treat. And so I would like to just mention here in this connection that when we talk about homeopathy and homeopathic substance, we should switch from thinking in terms of symptom and a drug with certain results. We should switch our thinking into a process. I perceive a homeopathic remedy as a process, and it's been prepared in a certain way that is virtually, there's no more substance or the material substance in the remedy. And it's like a template of a process that we introduce, and it works on the entirety of the body. And if it requires certain time and work in order to find a well-matching remedy. But then it always pays off because there are no side effects. Or we can, we'll get to this later, or minimal ones. It's not harmful. In the worst case scenario, it just wouldn't work. In the best course scenario, it will work, and it would produce a very balanced action, and we don't have to worry about side effects. We don't have to worry about dependence. We don't have to worry about creating the resistant microorganisms in that. So that's the things to, those are things, the points to consider when comparing homeopathy and allopathic medicine. Of course, allopathic medicine is also very useful, and Western medicine in terms of whenever we come to acute urgent situations, bleeding stomach ulcer or throat fracture of a limb, anything like that, there is no room for, well, there is room, but it's a different framework. Allopathic approach will work much better, where you need to just work with this head on. You need to address the issue, and then you can actually add homeopathic remedies very effectively in their recovery period. So I would say balanced symbiosis or balanced interconnectedness or usage of both methods would be useful, but homeopathy is gaining more momentum latest decades, and yes, and there's a science behind it, and it should not be overlooked. The benefits are good, especially when we're talking about children.
Yeah, absolutely. And I think one of the big points here to consider is this failure to look at the whole patient care. I think we are trying to get a little bit better with that in terms of Western care, but the whole biopsychosocial aspect is so important. And that is something certainly that we at Face to Face Health are really highlighting by having all these different types of care, in the one place. Again, I like your comment about the symbiosis between allopathic as well as homeopathic medicine. And a little bit later on this evening, we'll actually be talking about particular, childhood conditions in which homeopathy is of primary use. And then, of course, there are going to be a whole range of conditions in which you would have an interconnectedness between the two, or primarily only use allopathic medicine. So once again, there's a balance and there's some give and take to all of this. So, Sergey, let's move on. What is the basic principle of homeopathy? We have a Latin phrase here, which I'd love for you to explain to us.
Well, it's very clearly here, similes similibus curantur. That means like shall be cured by the like. In fact, even though they say the Samuel Hahnemann, German physician and chemist, invented this method, in fact, this principle goes far, far, far back in history. Because if you look in the history and the principles that in the medicine in Arab medicine sources like Avicenna, anyway, even Hippocrates also mentioned that somehow this principle was not upheld and not used. Although that's actually his idea. Hippocrates himself introduced that very idea. So there are many references to this. Now, why is this? I'd like to say something on this point because that's really important to understand. Now, in my view, and that there is underlying oneness in the entire, world we live, meaning that there is oneness that we as human beings participate and have something in common with any realm of life. Plants, we have in common with the plants, in processes that are in plants. We have something in common with minerals and the processes that the minerals undergo. And then also the animals, we have something in common with them. So because this is all particles of this, but we live in the one world. And this principle really relates directly to that oneness, because if there is something that we need, it's already there. It's not, we don't need to really create it from scratch. It's like anything that used to us, like foods, we just, there are plants, there's all kind of foods. We consume foods and they are available to us. So it's remedies. If you see, because that's based on the idea of this oneness. So we have relationship and participate and have a part of that process in the relationship in any realm of the world is in us. That's why the substances we need are already there. We just need to understand how to use them and how to prepare them, and that's the skill. And so this like shall be cured by like is one remedy perfectly matches all patients' symptoms and work as a cure on individual disease. Why is that? Because the idea is this. So the method that Hahnemann used was that he took poisonous substances, toxic substances, and by so-called pruvings, by taking them in a material large dose, the certain symptoms were invoked, and they were carefully recorded and cataloged. And so then one remedy is prepared, and those symptoms actually represent a certain morbid conditions we're very much familiar with. And so when remedy is prepared and there's no more toxicity in it, then it serves as a remedy, as a curing agent or healing agent, because it probably produces some kind of an effect or process which resembles very much the morbid process at hand in this in the situation. And it's like a catalyst, I say, a catalyst that hits the target and turns on the organism's own healing forces. So it's very much holistic. So in that case, the organism is strengthened and cures or heals itself in a most harmonious way.
Great. So you had mentioned particular processes and substances. I want to mention this. Homeopathic medicines, this is something that we hear. Homeopathic medicines contain steroids and heavy metals.
Yes, I mean, there's so many homeopathic substances that have been prepared because, yes, heavy metals, there are remedies produced out of metals. You can call, I mean, there's arsenic. It's a toxic metal. There's mercury. It's a toxic metal. There is stannum or tin. There's aluminum or lead. I mean, pretty much all the substances that we use in homeopathy, if taken in a larger material dose, would be toxic. But in this particular case, heavy metals, yes. But because the process of preparation of the remedy involves such refinement of the metals, so there is virtually no material dose. There could be some, but virtually it's all in the level of information that it doesn't produce a toxic effect, because the idea, it's in the principle, you do not want to harm. But by preparation of the remedy, other metals and other substances that are toxic in large doses, then we remove the toxicity and we just leave the template of a process which we introduce. And that's why it's 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 not harmful. So it's steroids. I mean, there's other examples of that. There's also homeopathic prepared out of antibiotics, like penicillin, for example, or many others. Why is that done? Because steroids produce serious side effects, also antibiotics. So the homeopath came up with the idea that if you give the same substances in homeopathic preparations, they would work to alleviate the side effects of those medications. So that's why we're talking about this. Like steroids would be prepared homeopathically, would be given to a patient who is taking steroids to minimize the side effects of those long-term steroid treatment. And
Right.
so,
So, you know, when you look at this statement on the surface, it looks like it is correct. But when you actually explore that in its complexity and break it down to how you actually prepare the homeopathic remedies, what you're saying is that these are really negligible traces. And this is a nice segue into how you actually do prepare the homeopathic medications that you use for your clients. So if you could just explain this very interesting picture to us.
yes, it's very interesting to me as well. So yes, so the homeopathic remedies prepared from natural substances of plant, animal, and mineral origin. Usually, that's the bulk of the homeopathic remedies are prepared as those substances by way of processing. So the basic attempt is if we take, for example, Calcarea carbonica. That's the shell. You know the shell the fish.
Yep.
So, and you start by, it's a mineral substance, and you grind it. You grind it to a fine powder. That's the first step. So any substance that is solid needs to be ground to small particles, very fine powder, and then that material then is introduced into a solvent. It could be either water or alcohol. In most cases, it's water. And then what happens when the dilutions begin to? I mean, so what do so this basic first solution of in water, for example, of this substance would be called the um, mother tincture, or very concentrated tincture. And then you begin to dilute it. So you take, depending on the potency, either a tenth or hundredths. We'll just take decimal potencies. 1/10 of this mother tincture will be taken and diluted, and in 9 times, yeah, right here, and diluted 9 times. Yeah, so this is how it's produced. So you take this mother tincture, you will see it's natural substance on the left, and the further right you go mother tincture. You see that, and you take 1/10. In this case, it's centesimal, so that's 1/100. And you start diluting. As you dilute more and more, then you can maybe go back to that slide because it was really pictorial. Well, yeah. You see these yellow things, the particles of the substance in the mother tincture, and then you start diluting. From A to B, you see less particles. And what happens, these molecules around these yellow particles are the conglomerates of the solvent, of the medium, that begin to form some kind of structure. Then you dilute it further into C, D, and so forth. You'll see there's less and less actual substance, but the particles, the molecular structures, or they're called clusters, in the water on the solvent remain there. And then as you dilute, they begin to become more and more organized. And so there could be, that's why it could be virtually no substance when we come to high dilutions like 15C or 30C.
Yeah.
And yet the information is not lost. It's kind of refined to a degree to which we want it refined. So that's the idea. That's a good slide to illustrate that. So
Yeah.
the micro photographs, or the photographs on the high magnification of the substance, on the very left, you'll see the undiluted original substance. which produces this kind of picture. Then you next one is diluted and succussed. Now dilution is not enough. Succussion is dynamization. So what happens when it usually was done by hand, you just vigorously shake it. Now it's done mechanically. But again, some producers still use manual shaking. So the shaking does this. It makes the substance disperse and kind of give the potency or the information to the medium, so that dilution and these succussions or dynamization is important in the preparation, because what happens is, like I like to compare to our digestive process. You can just take a potato, yeah, and just eat it whole. You cannot. We need to cook it first. That's actually first part of the what? It's part of the this grinding process, so to speak, preparation. So all these processes happen on us naturally. So once the potato is cooked, we cut it. It's getting smaller and smaller. And when we take it and we chew it up, and it's getting even smaller, then you have digestive enzymes and the mouth cavity, and then further in and stomach and along the entire digestive tract that does exactly what we're talking about here. It takes that substance and it makes it smaller and smaller and breaks it up further and further and deeper until you can release the goodness of that. And that released goodness, which is almost, well, it's a material, no more longer potato, but only then the body can extract and take in the nutrient, the goodness of the food. This is pretty much exactly the same process. We just take the substance, we prepare it, we refine it by diluting and potentizing it to disperse it and release. So it's like the surface of the active surface will increase with the refinement. And so we get, that's the idea. It gets stronger somewhat the further we dilute. And so you see the picture confirms that. The structure on the left, undiluted, is blue, kind of gets in pinkish and quite red. And this inner structure around the core as well, you'll see there's something going on there. So you can visually actually perceive that it's not just a myth. There's something physical, chemical, biological process happens during this preparation.
Right. And then the reason, of course, that we put this slide up is because of this idea that homeopathy is more of a pseudoscience, and that these number of dilutions really extracts, everything out of that particular remedy. So how could it potentially be working? And I think this slide is a very nice way of demonstrating, as you say, the molecular changes that are apparent even with, dilutions of 200 times of that of the original concoction. So this leads us to this statement: the doses of homeopathic remedies are too minute to be effective. And we had touched briefly on dilutions and understanding the dilutions, but something very interesting that you told me is that depending upon the number of dilutions, that is what determines, its use.
Yeah.
So if you could explain the dilution process.
Yes. It's dilution and or dynamization. So this vigorous shaking is also an important part of that. You can't just dilute, you need to work with that substance. You actually need to succuss it. But we already know that. Now, the dilutions work on different levels. The principle is such is that the lower dilutions, like this one is 6C, it's a 6 centimole dilution, work better on a physical or local level. So meaning that they would address more localized symptoms, or whenever we have the acute process, like acute inflammation, acute fever, something that would work on a physical level, symptomatic level more so, or local level. Now, medium dilutions, 9C, could be 12C as well, 9 to 12C, work on the level of general signs and modalities. What does that mean? That means more generalized symptoms, or even some neurological manifestations, like maybe chronic conditions would be that are addressed with this, like a chronic um, inflammatory process, or something that is more generalized, not in one part of the body, or it's more general process.
Right.
Yeah. So, and then the high dilutions like 15C or 30C, they work more on a level of psyche or nervous symptoms, general even behavior, and so the higher you go with dilutions, the more refined is the action, and so because we in our structure we're refined at most in our nervous system and our psychic life, then this affinity and this correlation with this. So it's like a step by step. You go from one step to a coarser a process on a more coarse level. You give less of a dilution. In the medium, you address that with a medium dilution. And then you go with psychic, yep, nervous. Yeah, you would work even more refined remedy.
Right. And this actually brings us to, you know, this particular, I found this very interesting. You were talking earlier about, the molecular structures changing, and I guess the memory of these minute doses of the natural substance. Can you explain this particular picture to us?
Yes, this is like a graphic representation of what happens um, in the substance when in the medium, like in this case, we're talking about water. What happens in the water is a medium when the substance is introduced and walked through that substance, so to speak. So it's not just, yeah. So you see this is actually a result of physical chemical research. There's a lot of research, even independent of homeopathy. But then when we started studying the behavior of water as a medium or as a medium or information carrier, so there's a lot of research. But then because homeopathy is related to this issue, and there's also research actually dealing specifically with homeopathy and water structures. Mm-hmm. So you see these clusters. You see it's certain shapes here. You see it's not random. It's not homogeneous. You actually see there's certain differences in the structures, and that's the whole idea that the water as such is not just some kind of a neutral substance. You see, if it's prepared or if it has gone through a certain process, and it's done. If we do it intentionally, we can introduce a certain information in the water, which would produce a certain effect. And interestingly, this was very well known to the earlier scientists of the past, so-called alchemists, because they back then alchemy was the actual science. But what's interesting that they considered rainwater, spring water, river water, and the water from the dew of the plants in the morning, completely different water. It's not the same water. It's just cold water, but it's entirely different. Rain water, especially in the thunderstorm, it's one type of water. The water that comes out of the faucet, that's entirely something else. And then the highest esteem was given to the dew, the morning dew. That's that was the most potent water. So that's not new. It's just we just getting the actual scientific confirmation that the water is not just a homogeneous something. It actually a universal substance that carries information, and we can work with that.
Yeah, and so I just very briefly want to point out one thing before we move along. We had talked about research. Of course, there are many very large randomized control studies looking at homeopathy and the way in which it works, the molecular structural changes in both the natural substances as well as the mediums that you use. And of course, one glaring issue here is the lack of funding for homeopathic research. Of course, a lot of the funding for medicine goes behind Western traditional, research. A lot of it is funded by pharmaceutical companies, by government organizations. So homeopathy in that respect is kind of a little bit of a poor neighbor. So there's definitely a lot more area for research. It's probably not as well funded or supported. So with that in mind, homeopathy is not effective in acute illness. I'm sure you've come across this statement time and time again.
Yes. Yes, I did. Yeah, and then also there's also such thing people, or you can find a lot of it in the literature. It's just a placebo. Well, placebo itself is actually not nothing. It's not. It's something, because placebo is actual perception of a person who's taken a substance that doesn't really produce any kind of effect. And placebo works as well. People believe that they're going to get
Absolutely.
better, and they do that.
Mm-hmm.
So placebo is not nothing. That's one point. Now, they say that you can counter it a lot. Like, this is, oh, it's just homeopathic. It's like homeopathic remedies is like just like placebo. Well, I would argue with that. It's really not so, because because there is definitely, you can observe actual results and actual outcomes, especially in acute processes, especially in children, especially younger people, and when there is an acute process. So, for example, a classic example would be given a child with, or even an adult with the fever, belladonna, and then what it does, it matches certain symptoms, certain picture remedies. So there would be a fever, there would be a redness of the face, it would be very cold feet, and then there would be sweating, and then there will be intermittent fever, up and down. And so you give a remedy, if you match it with belladonna, it's usually, it's quite visible. And if you talk to a patient, you see the actual patient, you will see it gets clear with time, or it gets easier to detect it with time. And then, so what you do using belladonna, you break that fever. I mean, with time, it gets better. I mean, you give it, in the beginning, you can give it every 30 minutes up to 1 hour. And if as it gets better, you give it less frequently, and you give the lower dilution. So, especially in acute situations. In fact, there was a historical fact that in this very country, United States, there was an epidemic of cholera, yeah, successfully treated. A lot of people were treated with homeopathics, and the recovery rate was incredible. That was, I think, back in the 19th century, when homeopathy was still in its prime. And yeah, so there are many confirmations to that.
Right.
Yeah, I can talk about this for a long time, but
yeah. I just want to point out here, if anybody does have any questions, please pop them in the Q&A box or in the chat, and we would be happy to address those as well. But Sergey, I just want to bring you now on to, its use in children. Obviously, homeopathy is used, as I mentioned, across the age spectrum. But there are some common, parental concerns that we often go to our GP for, which can also be addressed in a homeopathic way. So perhaps we can just kind of pick and choose a couple of these issues. So you'd already kind of briefly touched on fever. Earache is a big area. So perhaps let's just talk a little bit about earache, perhaps teething, and then move on to travel sickness, because of course travel sickness is something that does affect a lot of kids. And unfortunately, we can't use a lot of medications in those particular age groups. So I think that might be something that we could discuss. So perhaps if we talk a little bit about earache to start off with.
Yeah, I just touched a little bit about on fever, rapid onset cold flu-like symptoms. There are actually 3 remedies that are classic, especially in kids, but also in adults. And there's in addition to belladonna, there was also aconitum, natellus, and then there's a ferrum phosphoricum, and they're like classical ones. In any acute inflammation, you'll see them all again and again. It just keeps coming. But these are good to know about when you actually need to discern which one to give, because there would be a little different manifestation. And that's the real difference, because in allopathic medicine you just give them everybody the same protocol, and you just don't question that. And homeopathy, you have to be more selective here, because you observe the process, you observe the patient, you observe the manifestations, and you want to target it. I want to target it, and in a precise way, and then I can expect a good outcome. So that's just briefly about fever and flu-like symptoms. Now moving on to acute otitis media, this is huge in pediatrics, because I myself remember incredibly painful ear aches when I was a kid, and it's because of a certain anatomy. The children have a different shape of the eustachian tube, or the canal that connects the nasopharynx and the middle ear. And so as we grow, it becomes longer and narrower and more descended. In kids, it's more like much wider, shorter, and straighter. And that's why they're prone to this to the acute otitis media. And in allopathic medicine, the approach is to, of course, they used to give antibiotics right and left. They're now more selective. But this persists, the problem persists, because the use of antibiotics, and they still give them children antibiotics at some point of time, would lead to driving this into chronic condition. That becomes a problem, and might even lead to a chronic otitis. And then even loss of, well, I've seen cases of deafness, and I've seen serious complications. But so the homeopathy in this department offers very many opportunities. There's, again, we see ferrum phosphoricum. It can be given belladonna, and there's also capsicum. It could be given as a protocol of 3 remedies at once, because they would the idea is that some of them would work. But usually, and then if you usually give 5 pellets each every hour, and if it's a small child and they can't take it under your tongue, usually they give it under your tongue to be dissolved under your tongue, because there's this network of blood vessels that absorbs it readily. But the small children breastfed like babies, you can't give it to them because they might spit it out. You give it, crush it between the 2 spoons, and mix it with water or breast milk, and you give it in that fashion. And so then is sinusitis, acute. So the acute is a whole range of remedies. I don't know. I don't want to overwhelm, but I can just briefly mention them. Like kali iodatum, big one when you have irritant and profuse discharge, and there's a pain in the frontal sinuses and a sensation of constriction at the bridge of the nose. So it's pretty distinct picture, clear, so that's the difference. Homeopaths should know all these things in order to be effective. Now, this kali bachromicum, similar to kali iodatum, but discharge is greenish yellow, will be thicker, greenish yellow, runny, viscous, and sticky. So that's those details important, because why? They represent a certain process, a response to inflammation in a child or a sick person. And that difference we want to know and observe in order to administer a proper remedy. Now, the big one is teething, and it's a classic. Everybody probably knows. Chamomile, and there's a certain picture. It's a hyperesthesia of pain, very irritable, capricious mood, digestive disorders accompanying this. Also, chamomile is used in digestive disorders, right? It's chamomile tea.
Right.
And then you start with higher dose, in this case, 15C every 15 minutes, and then taper frequency with improvement. So you would give same dilution, 15C, but you would give not every 15, you would give every 30 minutes, every hour, and so as the situation improves. But that's simple remedy that works. And otherwise, the parents of those children with teeth can't sleep for weeks and months. So there's simple solutions.
Mm-hmm.
Now we move into trauma.
So, okay, let's actually, sorry to interrupt, let's actually move on to travel sickness, acknowledging that, that we do treat bruises, sprains, and fractures as well as bites with homeopathy. But if you wouldn't mind just touching on travel sickness.
Yes, of course, yes. Well, it's the big one, in pediatrics, of course. Many children do suffer from that. I mean, in our modern life conditions, we all move around in vehicles, cars, and vans, buses, airplanes, boats, and so forth. So there are several remedies that are classic, and they are the three of them that are worth mentioning right now is populus, is indicated in form nausea and vomiting with sensation of violent vertigo. So vertigo, spinning, um, nausea, vomiting. It's populus 9C. It should be given quite often in acute situation, and again taper with improvement. The next one is tobacco 9C. It's a tobacco plant. Tobacco. It's a The picture corresponds to a real vagal attack with pallor, cold sweats, nausea, vomiting. It's like close to fainting situation. Palpitations and vertigo and faintness. So that's the vasovagal syncope, they call them, right? Or something similar to that. Mm-hmm. And borax 9C, indicated when there is an aggravation, an up and down movement. Up and down, like in a car ride, or it could be a flight, up and down, and forward tipping movements like a boat or a ship. So like up and tip, and then borax 9C. So all these are 9C, the medium dilutions, because they work on a general kind of a picture, general level of symptoms. That's why we will give medium. So again, it's populus, tobacco, and borax, depending on the presentation.
Right. So again, it's very individualized, as you mentioned. So side effects, and then there is this concept of homeopathic aggravation.
Well, there are no side effects per se. So it's like that we can speak about homeopathic aggravation. What does it mean, aggravation? It means this. It's actually good, because when you see, and a great example is when you have a person with some kind of skin manifestations, and which corresponds to a sulfur remedy, and you give that sulfur, and when you observe the eruptions on skin get worse with that remedy, and I've observed that too myself, and then after that, that's aggravation. That's what homeopathic aggravation is. It's not exactly a side effect, because we want this to happen. Because after the aggravation comes what? Relief, and comes the alleviation of those symptoms and the general improvement. So aggravation, in fact, points to the successful therapeutic approach. That's what it is. And side effects, really no side effects, and because these remedies are considered harmless.
Natural based.
They're considered harmless. So yeah, it's the question that usually is asked is whether this homeopathy works or not. It's really not the issue with the side effects.
Got it.
The question is always whether it's real or not. That's what it is.
Yeah. So again, this brings me to this statement: homeopathic practitioners are lay people lacking in medical professional training.
Well, good one.
Strong thoughts on that.
It's a good question here, and one reason is that what is a certain situation about homeopathy and homeopaths in the United States, because FDA actually allowed to sell or allowed the distribution of the homeopathic remedies openly. You can find them anywhere, the health food store and pharmacies and other sources. But you can buy, you don't even need any license or anything, training to pick it. You can just pick it and buy it or pay some $8, $9, $7, and you're good to go. That's maybe why, because it's easy. Maybe it's too simple. Maybe that's why people think that you don't need any education, you don't need any understanding, in-depth
Yeah.
training to be good at it. Um, it's not exactly true. I mean, a lot of people, I think, use them without deep knowledge of the process, and that's fine. Uh, but if a more skilled approach and skilled expertise level practitioner is required for addressing some other more complex situations, then you definitely need to work with a professional.
Yeah.
And
So how does the public, what credentials should the general public be looking out for? How do we know as lay people that this is an expert homeopath?
yes, that's a very good question again. We know about naturopathic doctors, NDs, and they all are trained in homeopathy because that's the standard curriculum component in the naturopathic medical training, and they are actual medical professionals, and because they go through clinical training and actually they understand the Western medicine and they understand the homeopathy. So, and these, as a rule, very good homeopaths. Now, also there's a number of colleges and schools for homeopathy in the United States, and I could just name a few. And now, again, this training is very rigorous. It requires hundreds of hours of clinical work in order to receive the certificate of registration. I just can name a few, but there's actually a lot of them around the country. So there's Health Freedom Coalition, there's a Council for Homeopathic Certification, CHC. That's the one to look for. If you see CHC, that's a good sign. That's a good homeopath because that one requires a certain not just credentials but also practical work, and you need to prove it. So, Council for Homeopathic Certification, that's a credible homeopath. Council for Homeopathic Education, North American Society of Homeopathy, National Center of Homeopathy, Academy of Classical Homeopathy, and so on. And usually you would see RSHOM type. It means Registered Society or some RSHOM Home. And that's a Registered Society for Homeopathy.
Got it. Okay, great. Thank you. So Sergey, we're getting towards the end of our time. If there were five
Okay.
things that you would want people to remember from this evening's conversation, what would they be?
Well, here they are. Homeopathy is a valid therapeutic method confirmed by over 200 years of a practical experience, and that's true. Uh, there's a sizable practical experience and ongoing research. Homeopathics are inexpensive and effective remedies. Yeah, especially if you know or you encounter maybe a skilled professional homeopath who can recommend what needs to be done or taken in certain situations. But many people can take them symptomatically uh, as well. Yeah. Children particularly responsive to homeopathic remedy and show good results. Yeah, children are responsive because why? Because in children, uh, all the processes, morbid processes, are usually acute. They
Mm,
are acute, rapid, and very straightforward. And that's why they're responsive to homeopathic intervention remedies much better and faster because it's just so like you can name a lot. Apart from the ones we discussed, there's also diaper rash, there's a cradle cap that could be really successfully treated. And then there's a number of others, including skin conditions, eruption, and so forth. Now, next one, it is impossible to overdose on homeopathic. There's virtually no side effects. That's all true. You cannot overdose because we're not talking about the material dose. We're talking about the potency dilution and actual targeted skilled application. And I say virtually no side effects. Well, maybe there could be aggravation, worsening, but
mm.
usually you don't deal with that. You don't have this kind of situation in homeopathy. And the skilled homeopath can provide a good therapeutic solution for children and their families and adults. Yes, that's true. And I'd like to emphasize once more, homeopathy is very good in pediatrics. Yes, it's a really inexpensive, simple, harmless, and effective way of treating many conditions in children.
Great. And of course, there are several other conditions that we did not have time to go into today, including allergies and asthma, which are big pediatric concerns, which is, I feel like, an entirely different conversation altogether. So perhaps that will be one for the future. I do have just a couple of very quick questions, Sergey. So I'm just going to pop you on the screen. One of them is, does it take long for homeopathy treatment to actually work?
Well, in acute situations, you'll see the result quite soon. It's not going to wait for a long time because, or it's like this: if the remedy is appropriately chosen and given, sooner than later, you will see the result. If it's not appropriately chosen, you just won't. You just need to go on and find a good one, the actual one works. You will see the result, and then that's the idea. You will give those in a low dilution. You give it often, 15 to 30 minutes until an hour. And actually, the sooner you apply, the sooner you use it, the better it is. Like arnica, for example, the sooner you, after the trauma, you use it, the better result would be. Now, in chronic conditions, it goes actually like this. It takes 2 to 3 months per year, 1 year of a chronic disease to get anywhere. So in chronic conditions, it's a prolonged, and that's, it's a long process. You would take it less frequently. Maybe it goes once a week, once into bi-weekly, once a month. But the relationship is like this. The longer the disease has been around, the more time it's going to take to address it or treat it.
Yeah,
So
and that's intuitive, isn't it? Yeah.
Yes.
Yeah. Another question I have, can I use, and I think we've already sort of answered this, but can I use homeopathy alongside conventional medicine treatments?
Yes. There's no problem. There are no interactions because the principle of action is very different.
Yep.
And you can take it along with the allopathic remedies, no problem. In fact, if you want to even subside or deal with side effects of allopathic remedies, you can successfully use homeopathic remedies at the same time.
Yep. And just one thing I'd like to point out here is, of course, whenever you're speaking to any of your practitioners, whether they're your homeopathic practitioner or your conventional medicine practitioner, it's always important to tell them what you're taking. And whether it's homeopathic or allopathic medications, you must let them know. Last question, if my symptoms get worse after starting treatment, do I stop or what do I do?
Well, that's case we already discussed. Remember, aggravation. So if it actually gets worse in the direction that we intended or observed, then it's a good sign. We would call it aggravation. And then it probably means that we actually hit the target and we gave the right one. If it gets worse and it's different, it looks differently, and it's probably either unrelated to the remedy, maybe it's something else, or worse in general worsening. But usually, if you, I don't want to repeat myself, but if you get worse, and that's what it looks like aggravation, then it's not so bad because you're going to get better after that.
Yeah. Of course, it's a conversation that you have with your practitioner rather than treating yourself or making those decisions. It's something that you should do, of course, alongside with your practitioner. Sergey has very kindly provided some resources here for us. The first couple are, more kind of scientific based information about the idea of water templates and remedies. And then of course we have a couple here, which are sort of more easy to read, right, for parents and their kids. So I actually do have one. It looks like I may have another question, which I need to.
I would like to say something about this.
Yes, absolutely. Sure.
There's list on that slide when there's a homeopathy patient education that are that's about treating the behavioral conditions in children. And it's a very interesting article because it's actually written by GP from
Okay.
UK. GP, he's a GP
Yep.
doctor, but he used homeopathic in behavioral situations, and this article addresses that. And the last one is very interesting. It's about the arsenic poison in Bangladesh.
Mm.
Yeah, because there's a area in Bangladesh. I mean, that's a problem, long-term problem for Bangladesh, because people get poisoned by water they drink because it contains arsenic. So what they've done, they've actually used arsenic prepared homeopathically on mice and rats, not even on humans. And what they found, and mice and rats also were consuming the same water from the same source. So they were also arsenic poison, right? And so when they gave them arsenic homeopathically prepared, the mice and rats, the express or the excretion with urine and feces in these animals, I mean, they excreted a lot more arsenic. And so they eliminated arsenic from their system. And then they say, because it was not done on humans, you cannot say it's a placebo thing. The animals don't know. So very interesting article. Anyway, it's
Uh, uh, I do actually have one other question for you from the audience, from Ellen. When can I just do some, it's a great question. What can I just do, sorry, when can I just do some research on the internet and then go buy remedies for my child at the health food store? And when should I see a homeopathic doctor? I think that's a great distinction to make.
yes, that's a good one.
Yeah.
Well, basically, it's not a bad thing to self-educate yourself on very basic homeopathic remedies as a parent of a child. That can be done. Like this, basically, a handful, like 5, 6, 7. There's actually maybe a dozen of very useful remedies that could be used in acute conditions. But then it entails that a parent would know what to look for and then has some kind of understanding. And so there should be some kind of preparation. But
Mm.
it can be done, yeah. And then it's actually a good way to do it because, again, you don't need to go to a doctor, spend time there. You can treat it yourself, but if you know what you're doing.
Yeah.
Now, that would be acute situations when, like a cold, flu, or
Fever.
yeah,
Yeah.
earache, yeah. But if it gets longer and it's maybe complex and you don't want to treat yourself, you actually want to see a practitioner. So you would go to a doctor. So anything that is more chronic and more complex and not straightforward, uh, that requires an assistant of a trained homeopath and skilled homeopath, because then it just complicated issue. You have to take into account too many factors for a person just to know.
Yeah.
Belladonna is a big one. Everyone can use it. Or aconitum is another. It's a sudden chill and you get cold, and this is how you get it. That's aconite. Belladonna is flushed, red face, sweating,
Yeah.
fever, up and down. Belladonna, and then you take the remedy, it'll break in the sweat, and it might be gone overnight. And then so there's a number of others that are really, I mean, paramphosphoric again, but basic understanding is required
Yeah.
to proper, yes.
Absolutely. Thank you, Sergey. So that brings us to the end of this evening's presentation. I just want to thank you again so much for your time and your expertise this evening. I think it's been fantastic. Of course, for any of you who would like to consult with Sergey, he is on our platform as one of our providers. All you would need to do is go to our website, f2fhealth.com, go to the care section of our website, and of course, you can just easily book a care session with Sergey. In a couple of weeks' time, actually, we do have our next webinar, which is a parent's guide to pediatric emergencies, which promises to be very interesting. We're looking at a lot more acute care as well. It's sort of a nice, I think, follow-up from Sergey's talk. Sergey, thank you again for joining us.
Thank you.
And thank you all for joining us this evening, and we hope to see you for our next webinar, Parent's Guide to Pediatric Emergencies. Have a great night.
Thank you.
Thanks, Sergey. Bye-bye.